Welcome to another episode of Preparing for the Unexpected. I'm your host, Alex Fullick, and as always, we like to talk about things related to disaster recovery, business continuity, COVID, resilience, emergency management, crisis management, anything that's relatable to those topics, anything that helps you, your organization, or your community prepare for, respond to, and overcome adverse situations. Today, I wanted to talk about health and safety committees. I'm seeing a lot of talk about health and safety being a part of operational resiliency, and they should. Before anyone wants to argue that, they should be a part of it, but they should also be a part of risk management, and they should also be a part of business continuity, where needed, facilities management, all kinds of different groups. And I wanted to talk about how health and safety helps become a part of those groups or work with those other groups, because I used to be certified health and safety many years ago. It's lapsed, so I know I should probably get that renewed. However, many years ago when I was on a health and safety committee, there was a lot of good things done with the committee and the things we identified. So I wanted to kind of go through that today. First of all, a health and safety committee is for everybody. It's not just a management committee, and it's not just an employee committee that points fingers at management saying, thou has not done. Okay, that's not the way it works. A health and safety committee is half and half employee, half management representation. The chairs, at least on the one that I was a part of, it was co-chaired, one by a management representative and one by an employee representative. And depending on the term identified, 1 year, 2 year, obviously people were reelected to those positions. And the committee was made up of facilities representatives, operational groups, technology groups, human resources, anyone that was within a specific facility. Obviously, the facility had to be big enough to warrant a separate committee. Usually a team of 20 or something isn't going to have a separate committee. And overall, we would meet every month, once a month, same time, or if it was a really big facility, maybe a little more often than that. However, we were able to meet once a month, and everyone sat on the committee for about a year and a half or so. And then new people could join the committee as other people left or become one of the chairs, depending on their position. One of the things that the Health and Safety Committee did, which relates back to some of the risk management, business continuity pieces, facilities management, et cetera, is we were responsible to do health and safety inspections. So we would have to go through the entire facility and find potential risks, hazards that could harm fellow employees. Cords across the floor, tripping hazards, open electrical boxes, or tools left on the floor, or anything that was out of the ordinary that could harm people. We would document that, what the hazard is, where it was located, what may or may not need to be done to that. Not as a recommendation that we recommend you do this, but more of potential ways to mitigate this risk or remove this risk are these type of things. However, we left it open to the manager of that area, whoever's responsible for it, to fix it the way that they need to fix it, because it's their area, they know best. Our part was to document it, make sure that it's reported, captured, entered into a formal report, given to management. Management reviews it, sign off, and it's stored. The risks are entered into the risks and hazards are entered into an overall risk log, and then they're managed on an ongoing basis. When they're resolved, well, then they're closed. Here's how this risk was taken care of, and mitigated or transferred, or whatever the case may be. If it can't be, because sometimes we're going to identify hazards that can't be addressed, give us $1 million and yeah, we can fix this wall or whatever we're identifying. That's not going to happen. But we can identify it all and put it in a log and monitor it ongoing so that there's no incidents. And if anything does happen, we've got a record of it, that it was identified, the risk was accepted, and here's how we were going about monitoring and maintaining that it doesn't come to fruition. So health and safety obviously identifies risks and hazards. Well, risk mitigation does that too. Not just financial stuff, because that's a lot of times when we're talking about risk mitigation and risk management, we're thinking the financial impacts to organizations and how that's going to impact our bottom line and those type of things, risks with partners and stuff like that. But sometimes the risks are internal, and health and safety committees and their inspections actually help with that. Business continuity gets involved because if something does occur, well, we need to make sure that the right people who, wherever we identify this hazard, if it happens, well, this group has to have some sort of a response to it. They have to be included in, communication, and this is what's occurred. So you're going to have to enact business continuity. So continuity was involved, crisis management was involved. Luckily, while I was on the health and safety committee, we didn't have any of those incidents occur. A lot of what we identified was taken care of, and it was a major data center. So there was a lot of focus on ensuring safety and security of equipment and people and everything else around it. So I was very lucky. But that's how all of these groups get together and meet and be a part. And it's a part of operational resilience. Remember, operational resilience is in the name. All the operating units, facilities, IT, human resources, all these ones that work daily to ensure the operations continue on a daily basis. Health and safety is one of those that helps identify some of the hazards, the tripping, the things that might trip you up. They're there to help out. Not to be ignored, and it's employee and management 50-50, so they work together. So that's what you can do with health and safety groups and how they can link with other areas and bring other people to the table. It's not just a group that walks around or just meets for a free lunch or something once a month. There's a lot more to it. If you leverage them right, they can help minimize some of that internal risks that you might have, some of those internal hazards that exist that you walk by every day and not really notice. So leverage them, be a part of it, reach out. Will definitely make your operations much, much better. In the meantime, stay prepared, everybody.